Dr. Francis Faduyile joins us now. He is the president of NMA. Good morning, and thank you for joining us today on the program. So let's start with this. What kind of feedback are you getting from, some of your members who are in the front lines for this COVID-19?
Thank you very much. It's a pleasure being here. I want to first say that all our members, wherever they are highly motivated. They have been working around the clock to see that Nigerians are taken care of for those who have been infected with COVID-19 disease. And I can say, despite all the difficulties that we have faced in terms of all the equipments and other supplies, it has been an effort that everyone is geared towards making sure that every Nigerian is taken care of properly. And we have vowed to continue to do within the reasonable limit of our power to see that we continue treating Nigerians who are infected with COVID-19.
Just to clear the air, I've heard a few people say the hazard allowance for doctors is 5,000 naira. Is that true? And if it is true, is that still enough motivation for them?
Well, we have thought that it would not be the best for us to start talking so much about hazard allowance, because if you look at it, how much a month is enough for someone's life. But the malady of what is happening is that doctors have been receiving 5,000 naira as hazard allowance for so many years. We have complained, and the government has not been able to see the reason why they have to increase the hazard allowance. For example, hazard allowance for university lecturers are in multiples of 5,000 that they are receiving. Meanwhile, we have doctors dying daily as a result of all these infectious diseases. Some 2 weeks or last week, we still have a young doctor who died as a result of Lassa infection that he contracted from a patient that he treated. So we have been complaining, and I think there is no doctor that is happy with that mega amount of hazard allowance. And if you see the allowances in terms of hazard in the West African states, you'll see that Nigerian health practitioners, doctors, nurses, and other health practitioners alike are poorly paid in terms of hazard allowance.
What would you expect to be the standard, given that, of course, all healthcare workers are what some people call the new armed forces now on the front line of this war, so to speak. So what, in your opinion, would be the standard to intubate them, to secure them, to assure them that the nation really is interested in their welfare as well? What are the standards you are asking for as president of the NMA?
Well, thank you very much. I must say that when you have diseases like COVID-19 that is highly contagious and we have a lot of death, usually the government is expected to have a comprehensive insurance for those who are in the frontline treatment. Because what happens to the family of the health workers by the time some of the health workers succumb to the illness? If you have seen this, the story of COVID-19 all over the world, you have seen that a lot of health personnel, doctors, nurses, and other health personnel died as a result of infection contracted from the patient while treating them. So the first one we expect the government to do is to have a comprehensive insurance that those people who are going into that treatment are well insured. Secondly, in other climes, we have seen that to motivate those who are in the front line, they have given some in multiple of 3 or 4 on their salary so that they can go with their head high and being happy to be able to contain the disease. Again, it is important that it's not only about fund or money that we are talking about. We have cases in which some of these health workers are infected and they get home and they infect their family members. So there are some areas that they are expected to be kept that is conducive and it is close by to where they are treating their patients. And these are some of the things that are expected of a country to take care of a pandemic or epidemics like this. Importantly, since the symptoms of this COVID-19 and other pandemic or epidemics may mimic other diseases that we are seeing like malaria and others, it is expected that the personal protective equipment, PPEs, and necessary environment is provided at the different hospitals where doctors, other health workers are seeing patients. Shortly, some few days ago, we have had a case in which people who came with renal failure was subsequently found to be a COVID-19 positive patient. We have seen cases where people who came with something that looks like gastroenteritis, stooling and vomiting, came down at the end of the day as COVID-19. And all these are scenarios that are not the normal way you may see them present. And if the doctors or the nurses or even the cleaners or people working around that place are not properly protected, they may now contract diseases and take them home. And this is some of the major things that we expect the government to work upon while we are having this kind of pandemic.
Well, speaking about which, and the soundbites we just heard from the Minister of Health just before we came to you, or speaking about Chinese doctors, we have read some of your views and some of your colleagues. Has your view changed about the Chinese doctors?
Well, I think it is important for us to again stress that total now we have about a little bit higher than 200 cases, and the treatment modality, the management we have been having in this country has been so fantastic, and many have been discharged. And if we are doing well, we wonder what the people are coming to give. Every environment has its own peculiarity. The peculiarity is Nigeria will certainly be strange to those who are coming from other clients. Yes, they may have their experience based on what happened in their area, but if they have to share experience, there are so many ways through technology that we can get this experience shared. It does not necessarily mean that they must come here physically, unless that is one of the conditions in which they are bringing those consignments that the ministers talked about. But importantly, we are doing very well. Nigerians are happy with Nigerian health professionals for what we have done so far. You do not change a winning team. We do not need the Chinese to come and teach us how we treat our patients, because we are treating them well. The question we want to ask is that what else are they going to give us? What else are they going to impact upon us? If it is certain that they have more, we can also do that by Skype. We can do that by other technology that they do not need to come here. We have a national policy that anybody who comes to this country must have to stay to quarantine himself or herself for a period of 14 days. Are they going to break that rule because they are bringing some almighty set of people to come and treat or to come and help Nigerians? These are questions that are begging for answers. We know that as it is, the whole world is in a panicky state, but if we are doing well in this country, the United Nations has praised Nigeria for what we have done. We did not have Chinese people to help us when we had the Ebola virus in this country. We were able to contain it. And we have been doing well so far. So I think every Nigerian doctor, every health practitioner, including those of us who are not within health, who are journalists, who are other Nigerian citizens, will want our country to be safe. And we do not feel that it is important for the Chinese to come there physically. If there are anything they have to do, we will expect them to help us with their gift. We appreciate them, but their coming may not add any more benefit than if they can even do Skype discussion and others, which are teleconferencing, telehealth, and other things are in advanced stage. So this is the feeling of Nigerian doctors as well as every other health workers who have been in the forefront of the treatment of COVID-19.
You know, I recall that in February, the DG of NCDC mentioned that he was one of 10 global health leaders that visited China to understudy how China, responded to COVID-19. And fast forward a few weeks after, we got delivery of, test kits and protection kits also from China. But now with, the medical team, the 18-man medical team meant to come from China, we have gotten, so much objection to that. And I'd like to also ask, is this an issue of trust? Because it would seem like there's mistrust here. A lot of Nigerians, your association, the TUC, and other bodies don't seem to trust China at this point. Is that correct?
Well, perception is sometimes stronger than the reality. As it is, the COVID-19 started from Wuhan in China. And there are so many conspiracy theories that are in the air. But that aside, when the NCDC DG went to China, when he came back, he did what the national guideline states. He quarantined himself. Are those people going to quarantine themselves? That's the first question. Again, it is wrong ethically that you transmute yourself from wherever you are and you come and start working as a professional in another country. Have they passed through the necessary regulatory, professional regulatory process in this new country? Or who are they? What are their qualifications? How can you rate them? These are some of the questions that Nigerian doctors and Nigerian publics should be interested in. But by and large, if our DG NCDC has gone to China, I believe he must have had some experience. And since he has been doing well, if we need some brush up, he can be a trainer, he can start training others. If we needed additional information, we can discuss it over Skype. Coming here means a lot of breach on our already established protocol. Remember, COVID-19 was imported to Nigeria. And if you have followed the history of viral epidemics or pandemic, they can have different strain within short period of time. And if you know too, at a time they say another viral illness has broken out in China. They call it Hana virus. So we cannot just open our doors and allow people who may not impact seriously on the present situation on ground in this country. And that is why everyone as it is, has shown interest in improving and taking care of the health of Nigerians. And sincerely, in this case, on the cases of COVID-19, Nigerian doctors, all other health workers, and even civil society organization believes that there is nothing additional that these medical experts, quote and unquote, we add to the already, we are not yet overwhelmed. We are not yet overwhelmed.
Let me read this to you.
We need
This
PPE,
is
we need more testing.
Yeah, this is from the NCDC boss, while also speaking almost in the same breath at this matter. He says, quote, "We are not just limited by funds and infrastructure, but the biggest limitation is human resources, the people that are already trained in bionuclear diagnostic testing. This is not something you can take up people and ask them to volunteer and go into laboratory and start testing." End of quote. Could this justify why perhaps they might be needing these Chinese doctors?
Well, I do not know where he's getting his where he's coming from in his statement, but I can say categorically that it is not only China that we can get anybody who can support. We have some very will I say coincidence that are not palatable. You had when the Chinese had gone to help other countries and it has not abated the disease. And if, as it is, I can tell you we have very great Nigerians who can do the necessary or perform necessary tests that we needed to take care of Nigerians. I think as the situation is, we do not need any new expatriates coming to the country to contain this COVID-19. If it is any other thing, let them come out and tell us. But as COVID-19 is concerned, we are tackling it well. We are doing well. The Nigerian health professionals are highly motivated. And we are doing everything possible to see that we contain this COVID-19. I do not think, and a lot of us believed, that there is nothing extra that the Chinese will give to us. If they have anything, we have stated over and over that technology has made things easy. They do not need to see a patient. They may not need to come to our area. They do not need to pass through the 14 days quarantine that it is the national guideline. We can look at it over the Skype or other technology know-how, and we can get the same information and we can proceed from there. It is not mandatory that they will be physically present. And again, it also borders on professional ethics and national security. We must be able to protect our territory.
It would seem then, Doc, as we wind down on this, that the NMA isn't particularly working in cahoots with the Ministry of Health. Would that be the case? Because I also remember that the Minister of Health said that the lessons of a fight against Ebola in 2014 has been very, very helpful. And of course, you have alluded to how much the health workers have been doing. Does that suggest, from what you are saying, and which is completely different from what the Minister of Health said, does that suggest that the Ministry of Health, with the NMA, is not working toe-to-toe with the Ministry of Health in this fight?
Well, I do not think that will be totally correct. We have been interacting, we have been talking together, but sometimes you have some area of disagreement, and we must be able to ensure that we take the best interest for our profession, for our profession, from our members, and to also safeguard the life of Nigerian people. And also the Minister of Health and those who advises him also will also have the same view, but we really need to bring up our ideas together, synthesize it, and get the best. But in this respect, the Nigerian Medical Association was not really consulted, and when we heard about it, we expected that we will be able to have audience and get our position passed to the ministry. But before we get things
Right, Dr. Fadile, we are out of time. We do appreciate your thoughts this morning, Dr. Francis Faduyile, the president of Nigeria Medical Association. Thank you for coming on this morning. Well, we'll be back in a moment and take a look at some response from you on the issues we've raised today. In just a moment, don't go away. Welcome back. Already getting some feedback concerning some of this. Some of them, yeah, I mean, they talk about if the House of Reps did say Nigerians and China shouldn't come back to Nigeria at that time when this broke, and there was a lot of furore about it. Why are you not?
And it wasn't that
Chinese?
serious then.
Yeah, why are you not asking Chinese to come here? But then let's look at this one from Oshinowa Kingsley. He says, how does FG determine the poorest of the poor? Most of these poorest of the poor don't have bank accounts, not BVN. Some don't even have phones. How do these cash get to the beneficiaries? This has further exposed the inefficiencies and corruption in our system.
Well, this next one is from the Union of Allied Health Professionals. Yes, they tweeted at us saying, we condemn in its entirety the plans of importing Chinese experts into Nigeria by the Federal Ministry of Health of Nigeria at a time when our local capacity is already doing great to the extent that 23 persons infected with COVID-19 have been discharged. Well, add 6 to that or 7 to that, it's now 30. Support the local capacity, please.
And Ayodele Olutoye, Dad Matilda, says free electricity for 2 months amidst darkness or non-existence of the power. What Nigerians needs are food and social security funds. That's the most important thing to the larger percentage of the population at the moment.
Well, Efosa, let me look at what Efosa is thinking here. He says, reaching Nigerians is as easy as using existing data, BVN and more. It's also not smart to share cash in such volume. Using a system you create is also patriotism. Let's go further round, or let it go further round, he says.
Next one, Damak Beno says some local governments, Afikpo, North and South in Ebonyi State, have been on protracted blackout for over 5 years. And I'm sure they're wondering, will that touch us too? How will these areas and other places alike benefit from this stimulus bill? How will this bill cover prepaid subscribers? Those are questions from Macben Idam.
And Kingsley says, we have been advocating for data harmonization for ages, which would have made it easy to access the targeted groups. The government shouldn't be gathering people at this critical time just to share items. It could trigger communal spread of the virus.
Yeah, we'd like to know how you're spending your time during this lockdown. So send us pictures at Sunrise Daily Now on Twitter, or you can message us or email us at sunrisechannelstv.com, sunrise@channelstv.com. But you see the content or the information on your screen pretty much.
Yeah, so that is the show today. Don't forget, you can't go forward and backward at the same time. You know what to do. Thank you for watching. I'm Chamberlain Uso.
I'm Kayode Okikiolumi.
Namayo Makinde, please stay safe.